Good morning and welcome to this week's edition of NCompass Live. I am your host, Krista Porter, here at the Nebraska Library Commission. NCompass Live is the Commission's weekly webinar series where we cover a variety of topics that may be of interest to libraries. We broadcast the show live every Wednesday morning at 10 a.m. Central Time. But if you're unable to join us on Wednesdays, that's fine. We do record the show as we are doing today, and it will be available for you to watch later at your convenience. And I will show you at the end of today's show where you can access all of our show recordings. Both the live show and the recordings are free and open to anyone to watch. So please do share with your friends, family, neighbors, colleagues, anyone you think might be interested in any of the topics we have on NCompass Live. For those of you who are not from Nebraska, the Nebraska Library Commission is the state agency for libraries. So similar to your whatever state library. So we provide training and consulting and databases and grants and resources to all types of libraries in the state. So you will find shows on NCompass Live for all types of libraries, public, academic, K-12, corrections, museums, historical societies. Really, the only criteria is that it's something to do with libraries. We have Nebraska Library Commission staff that sometimes come on and do presentations for us about programs or services that we're offering through the Library Commission. But we also have guest speakers that we bring in, and that is what we have this morning. Joining us is Nicole Miller. Good morning, Nicole.
Good morning.
And she is joining us from the Cannon Falls, Minnesota Library. And she's going to talk to us about health and physical literacy program and doing that at your library. There's lots of literacy programs that libraries do, and this one has got kind of a different kind of twist to it. But it is something that a lot of libraries are doing, getting people active. So, excuse me, sorry, I got a frog in my throat. I'm going to hand it over to you, Nicole, to tell us all about how you've been doing this at your library.
All right, thank you. Welcome to this webinar, and I hope you learn a lot. This is also the first webinar I've ever done, so please be compassionate with me. Okay, so I'll go ahead and see if I can go over to my next slide. There we go. Okay, I'm going to tell you a little bit about me and my library. I'm the library director here at the Cannon Falls Library in Cannon Falls, Minnesota. We're about 30 minutes south of St. Paul. And I have about 3,000 total registered users, and my population service area is about 8,000 people, and we have about 36,000 visitors annually. So that's my library, that's my community. I have been a librarian since 2012, and I have my MLS. I've been a group fitness instructor through AFA since 2019, and currently I'm working on my recertification through a different organization, ACE. And I'll get into that a little bit more later because there are multiple organizations through which you can get your certifications. I'm also a professional gymnastics coach. I did that long before I was a librarian. And so I've been a USA Gymnastics professional member since the 90s. So I love fitness. I love moving my body. I love teaching people about their bodies. And I believe that libraries are about literacy in all their forms. So we talk about book literacy, textual literacy a lot, and digital literacy. And so I'm thinking about it. My approach is to expand to physical and health literacy to help our communities really understand their bodies and where to look for information about their bodies and who are reliable sources and where they can get reliable information. And because we're librarians, we're trusted resources. So I want to help you to understand all of that so that you can help everybody. Oh, and I also forgot, I've been on the Let's Move in Libraries advisory board since 2018, and that is really what got me started in this whole health and physical literacy trajectory in my library, because I thought that was pretty cool, and I'm kind of addicted to fitness and health.
That's
So,
with Lenstra, correct?
yes,
Yeah,
yeah,
he's been on the show before a few times. Yeah, he's did some presentations for us.
yeah, he's
He's
pretty
great.
cool.
Yeah, doing great work with that. Yes, getting people up and about. Yeah.
Yeah, and I really loved what he was doing, so I was like, I think I'm gonna get on this. So, okay, I'm going to go to the next slide, and I'm going to define health literacy and physical literacy, since I already talked about it. So, health literacy is the ability to access, understand, and use information and services to promote and maintain good health. The result of having good health literacy is that people with higher health literacy skills are more likely to make informed health decisions, which can lead to better health and longer life. So, when we're helping people with their literacy, we're helping their health. Physical literacy is the physical competence, confidence, and motivation to be active for life. When people have that physical literacy, they have they're more likely to be physically active, have better health outcomes, and are able to maintain physical activity habits throughout their lives. So, as you can see, these go hand in hand. And um, when we have a good solid approach, then we have patrons who are coming in to the library and they have better health. They're more active. They're not going into assisted living as soon. They're not falling as much, or if they are falling, they're recovering more quickly, or they're not really getting hurt. So, um, there are the definitions, and I am going to provide Krista with the slides, and I
Yes.
have links on every single slide for information. So,
Yes, I should have mentioned that. Yes, the slides will be available with the recording afterwards. So don't worry about trying to write all this down.
yeah,
Just sit back, take some notes if you want to, but you don't have to write all this down. You will have these slides tomorrow.
yeah,
Which we
exactly.
go back and read over.
Yeah. So, yeah, please don't worry about that. Okay, so next I have my learning objectives, because at heart I'm a teacher. So, what I would like you to come away from this webinar is to know your population and their particular needs. Every community is different, and the people who are coming to you with their health and literacy and physical literacy needs might be a little different than the people who are coming to me in my library. So I really implore that you get to know your patrons. You already know them anyway. My second objective is to help you know where you can get trained in applicable fitness and health modalities, because it is cheaper for you to get the training than to pay somebody else to come in and do it, by a lot. My third objective is to help you know, or to help you use your own librarian skills, because we're librarians, to teach people where to go for information and how to evaluate that information. That's also digital literacy. So, see how it all blends in together?
It's all connected.
Yes, it all is connected. Okay, so this I figured I should kind of get into where it started. This particular slide is pretty much where I got started back in 2018 when I started this. I had gone to the Move Your Way library, or sorry, website, and the recommendation for years for physical activity has been at least 150 minutes per week of moderate intensity aerobic activity, and at least 2 days per week of muscle strengthening activity. Um, and I thought, yeah, that's really good. And then I looked at all of the data that the CDC was putting out, and the the older people get, the less physical activity they're getting in
Mhm.
particular. And the data is changing. I'm not really able to find really good data right now for the current crop, but back in 2018, it was pretty sad, and it still is. So I decided to look around and do a community scan of Cannon Falls and find out what is needed in my community. And there was nothing in my town where people could try out different exercise modalities.
Mm,
And there was nothing that was affordable for
yeah.
people who are on a lower income or fixed income. And that is the particular um, demographic that has the greatest trouble with getting enough physical activity. So that was really where it started. And I tried out first with walking groups, and that had limited success because, you're walking outside, you don't know what the weather is going to be like. The timing was kind of off. This has evolved over time. And I made handouts for people that for every season of what kind of activity you can do that counts as physical activity and that's not exercise. That went over really well. I'll send that out to you too so that you can put those out if you want to.
Of course.
And then in 2019, that's when I got certified in group fitness instruction. And it's like, I think $400 for a 2-year certification,
Mm,
which is really,
not
really
bad.
doable. And then I started out classes once a week on Fridays. I called it Fit Fridays at that point. And the point was to do it at lunchtime, a half-hour class. Like for every 6 weeks, we'd try out a different modality of exercise. And then over time, it evolved into 4 days a week. And Monday, Thursday, I do resistance training with resistance bands. Tuesday, I do chair yoga so that people are working on their balance. And Thursdays I do something called walk to the rhythm, which is it's like walking in place to music, and we talk, and that's a moderate intensity. Every class is 30 minutes. That because that is meeting helping to meet these physical activity require or recommendations, not requirements. And it's also getting people in the door. It's also helping
Mhm.
people with building community, which is a big need in the country right now. And people are making friendships, making friends. It's helping people socialize. There are so many different positive aspects from these classes. And through trial and error, this is what's happened. And I've kind of ended up specializing in older adults because that's who really wants to come to my classes. So remember, your community is going to be different from mine, and you might end up having a completely different demographic than I have, and just go with it. So, next. Yeah. So that goes into what is your target population and what are their health and fitness needs? My particular population who are coming to my class are older adults. They're generally women in their 60s and 70s, sometimes in their 80s. And then I really do try to educate them on getting enough activity in their physical activity in their lives. Um, and like letting them know that walking, heavy housework, yard work, DIY projects around the house, moderate intensity cardio, and resistance training all count. Everything
Mhm.
counts. Playing with your kids or your grandkids in the yard, that counts. So that is lowering the bar for people to help them understand that physically they don't have to go do a workout that they might not enjoy, but just moving is helpful. because people aren't getting enough movement. And when you break down that 150 minutes of activity per week, that's about, if you go 5 days a week, it's 30 to 35 minutes. That's why my classes are about 30 to 35 minutes.
That's much less intimidating than 2.5 hours when you say
Yes.
it's actually, yeah.
Yeah, exactly. And so I really break it down for people so that they understand and they're not intimidated by it. And, that's all that health and physical literacy. Like, let's
Mhm.
break it down for people. And then I also talk to them about how the exercise affects their bodies. Like when they complain about when I make them jump, I say, but this is helping your bone density. It's helping your bones get stronger. If you have osteoporosis, this can help reduce or reverse the osteoporosis. If you have osteopenia, the resistance training will reverse the osteopenia. And walking, getting cardiovascular exercise, that's going to strengthen your heart. So it just talking to people about how and why activity is important, but also it's not just activity. Remember that I'm focusing mostly on the physical activity, but it's so much more, and I do incorporate more. Um, and to meet their health literacy needs, I want to help them feel confident about where to look for reliable information. Sometimes I'll print out studies or abstracts of studies, and I'll just talk to them about this is a relevant study that has come out recently about food, nutrition, and I'll even talk to them about, well, that they had a very small sample size. So we are going to want to wait for more information about this before we can really trust everything that this is saying, because that it's also hitting the news. If there's a meta-analysis, I'll tell them this meta-analysis is the gold standard about this particular health topic, and so this is giving us really good, reliable information. So that is helping them with their health literacy needs, because then if they're turning on the news or reading the news and they're getting some kind of news about health, but the sample size from this latest study is small, they need to understand how to use their discernment about these studies.
Mhm.
And I also really recommend when they need to go to the doctor, because they'll come to me and say, "Oh, yeah, this really aches." And I tell them, "Okay, that sounds like a medical issue. You need to talk to your doctor. Or this is a movement issue. I really think you should go to a physical therapist, because physical therapists are masters at movement. They're experts in movement. Whenever they ask me anything about diet, you really should go see a registered dietitian for that. I can't answer that question because
Mhm.
I don't know your specific health needs."
This goes along with a lot of the kind of questions that we get as librarians in libraries, for legal questions, more intense medical questions. The caveat: I am not a lawyer. I cannot help you with your answer these legal questions. I am not a medical doctor. I cannot give you that kind of advice. You need to go to the actual professional. Yeah.
Yes, exactly. And I mean, as far as particular movements, yep, I am an expert. Like,
Mhm.
uh, if you really want to know how to do a perfect handstand, I'm your person. And if you want to learn how to get good scores at meets, I can help you. But it's not going to help my older adults coming into the library. So, okay. And then now we're going to move on to relevant fitness certifications. There are some specialized ones, and I have links on all of these. Chair One Fitness is it's all chair based. So if you have a lot of older adults, or if you have people who are um, have who really struggle with mobility, this is a really good um, specialization. And it's basically chair aerobics basically, and it's fun. Um, And when I had gotten that certification, it had to be in person, but then since COVID, now you can do the majority of certifications online. JerryFit is one that Noah Lenstra recommends through Let's Move in Libraries. That again is one that's more chair-based for older adults who are mobility challenged, and that also uses, if I recall correctly, dumbbells, low-weight dumbbells, and for resistance training. If you feel like yoga is your thing and your population would really like to do yoga, Yoga Renew teacher training is a really good quality one. And I've actually been working on getting that certification for a while. I really, really like the quality of the information that they're providing. There are some that are kind of iffy, but I do believe that Yoga Renew is a good quality one, and it is also in the past couple of years, I think it was last year, they started working with ACE, the American Council on Exercise, to be a sub-certification for yoga under that. And I'm getting recertified under ACE. So for more generalized certifications, and I really kind of prefer the more generalized certifications because I figure since we're overall a health and fitness literacy program, we're generalists and we want to help, we want to send people to specialists. So then I really highly recommend that as many people in your library have CPR, AED, and first aid training, no matter what. You never know when somebody's going to have a medical episode.
Mm-hmm.
And it helps to be able to quickly do that evaluation while somebody's calling 911. And then as far as the group fitness or personal trainer, these 4 that I've listed are all pretty solid. I currently have mine through AFA. I can't remember what the acronym stands for. I'm sorry. I'm terrible about remembering what acronyms stand for. And AFA is associated with NASM. NASM does more personal training certification. AFA is more of the group fitness. And ACE does both. And then NEDA, they're actually out of Minnesota. I haven't really looked into any of their courses, but they seem pretty solid. And I had put that in because when I did this presentation in Minnesota, I figured if any librarians in Minnesota wanted to do that one, they could.
AFA is, I think this is the Athletics and Fitness Association of America.
Yeah, that's it.
Yeah.
Yeah. And
those are links to all those pages anyways, right?
yes,
Yeah.
there are. And then you can look at the prices of what you want to do, look at the requirements, what they're going to teach you with those certifications. I opted for group fitness because that's more of a generalist and it's about half the price of personal trainer. And so then if I have only one person show up for class, I'm like, nope, sorry, that's personal training. I'm not certified for that. So go find a book. You know, it's a good time to check out some books.
Mm-hmm.
This program does increase circulation too. So that's a nice bonus. And then there was a caveat about all of them that I really wanted to point out. Every single one of these offers some kind of a certification to be a nutrition coach. And that's something that I really would recommend that you stay away from, because that then is becoming a pseudo specialist in something that could cause harm. Because I do see in online forums and whatnot that there are people who are personal trainers who have these nutrition certifications, but they're giving inaccurate nutrition information, or they're giving information that is very generalized, that that does not take into account that everybody has specific nutrition needs. And for example, if somebody has one kidney like I do, they have to watch their protein intake. And actually, letting you know, the recommendation is 1 gram per kilogram of body weight. So if you see 1 gram per pound, that's way too much protein. That's not what we should be getting. This is
It makes a
information.
difference to know
It
that.
makes a
Yes.
big difference. And if you have any kidney trouble, you don't want too much protein. So that's why I always say just, go see a registered dietitian. Don't take any kind of health nutrition recommendations from a fitness professional of any shape or form. And so I really, really, really recommend that strongly for you. Okay, so then the next slide, I am talking about amassing your resources. There, you can join the Network of National Library of Medicine, NNLM. That's free. They have a lot of different trainings. They even have classes and workshops that are all online that you can get for how to help your patrons assess health information.
Mm.
And they even have certifications for that. They have book clubs on specific health books. And I think that is really darn cool. So that's a really good resource for you. And you get an email from them a few times a week. You can also get the Move Your Way guidelines from the U.S. Department of Health and Human Services. There is a rather large PDF of like in depth of the research that they did and all of the recommendations that they have. That was published back in 2018. They haven't updated it. And so we'll use that latest that they have. This is one of my big things, become acquainted with the Academy of Nutrition and Dietetics. It's called eatright.org. And that will also explain to you the difference between a nutritionist and a dietitian, how in some states in the US, there are there like there are different requirements to be called a dietitian and a nutritionist. Some states you can just call yourself a nutritionist and there you go. Other states you do have to pay for certain kinds of certifications and continuing education. To be a registered dietitian, you have to get a degree in it. You have to, like a therapist, you have to do a certain number of internship hours. You have to sit for an exam to qualify for certification, and then they have continuing education hours. So a registered dietitian receives years more nutrition information, nutrition study than a doctor does, than a medical doctor does. I found out medical doctors only get maybe a couple of days of nutrition in all of their work. So always talk to a dietitian.
The
They're
specialists, that's what they're there for. That's what they've gotten their special focus on. Yeah.
exactly, yeah. So knowing our scope of practice. And there's also the Consumer Health Information Specialization, which is CHIS. That it's funny because that one it costs like $100, but they'll waive it for you. So it's kind of funny. But that
Okay.
is also it's like I think like a 5 or 6 part class where you learn a lot about health and physical literacy and the resources so that you can then help your patrons find everything. I love this website, Examine. It's a database which I get their weekly newsletters that come every Monday, and they take all of the latest studies about nutrition and health. And they put them all together in this database, and then they'll show the abstract, and then they actually look at it, and then they'll do a little blurb on, well, this has a small sample size. This is a meta-analysis. This is pretty good. You can get a subscription to this database for your library. It is pretty cheap. It's like, I want to say maybe 10 cents per 100 people in your population, something like that. It's doable. But the newsletter is free. So, um, but if you sign up for it and you really like it, then I suggest you go ahead and look into getting that database available for people in your library, for your community to research for themselves. And then if you're not acquainted with Medline Plus and PubMed, get acquainted. I love them. One of them, I always get them confused. I think it's PubMed that publishes the research. Like, you get to read the studies and about anything health related. I've gone to doctors and said, yeah, I'm a librarian and I know PubMed. And because if I say, well, I like to do my research, then they cringe. And then I say, oh, but I know PubMed. And then they smile and say, all right, I know I can trust you. You know what you're talking about. All right. And they've even said, oh, okay, you know what? Go do more research on there. And then let me know what you think. So that is very reliable. And then Medline Plus, I believe, is the one, and I could have them backwards. That's the one that's more for lay folk. That's just it's written for the regular person to read about regular health issues. And they're all from the National Institutes of Health. And there are actually more websites. Like, they've got one that is about alternative medicine. They have one that is on different medications and drug interactions and whatnot. There really is a lot. I wrote an article about that for our newspaper last year. I'll have to see if I can find it. Maybe I can send that to you too.
Yeah, and you are correct. Yeah, Medline Plus is definitely for, the layperson, not for the medical professionals, and PubMed would be a much more advanced. Yeah.
Yeah. My note for myself is PubMed is for the nerds who like to read the studies.
That's a good description. Yes.
Yeah. Thanks. Okay, and then the next thing I wanted to talk about is really think about your message. I really want to stay in the spirit of equity of access, so I stay weight and health neutral in all of my messaging. And the health and wellness community has a lot of biases, and particularly fat bias, even though there is strong evidence that your BMI, which is completely
That's a whole nother
inaccurate.
horrible. That's another discussion. Yeah.
Yeah.
Not something anyone should be looking at and paying any attention to.
Exactly. Yeah. So there is a lot of evidence that your weight has very little to do with your health. And that there are a lot of skinny people, it's called skinny fat, who are just very unhealthy. But there are a lot of people in larger bodies who are extremely healthy. So I really, really strive to remain very neutral about that. And I stick to evidence-based information with my community. And the information, the sources that I look for, I try to really be as inclusive as possible and educate people about movement. I want to educate them about just like movement. Like, you're gonna have your knee range of motion if you go beyond 60 degrees in, like, if you're squatting. and your degree angle is beyond 60 degrees, that's actually healthier for your knees if you squat to only 30 to 60-degree angle, which is a very, very mini squat. So, when you have people who have knee problems, suggesting that they go a little bit deeper is healthier for them.
Mhm.
Yes. So, and then uh, some of these places that I've gotten good information have been a newsletter from Reagan Chastain. It's called Weight and Healthcare. I think I might have forgotten to put that in. So you might want to write that one down. Another one you might want to write down is the Fat Doctor. This is a doctor in the UK who recently published a book and sends out newsletters and also talks about it really is very size inclusive and breaks down the research on weight. I did provide the link for Health at Every Size and Intuitive Eating. Again, remembering my scope of practice is I'm not a registered dietitian, but I will suggest that people look at Health at Every Size and Intuitive Eating because it helps people be more aware of their bodies. Intuitive eating is actually very strongly evidence-based, and they have 10 principles, and it helps you feel sated without worrying about your body. Um, and Health at Every Size is really just showing how you can be healthy at whatever size you are. A couple of other books that I recommend are The Wellness Trap and The Anti-Diet by Christy Harrison. She has 2 podcasts. I listened to them for a while. They're fabulous. And she talks about the whole history about fat phobia and everything. There are many more books too, but those are a few that I recommend to help you with your messaging. And then, so you've decided that you want to start classes, you want to have them. Think about your equipment. Have a good quality Bluetooth speaker. I happen to have a little Bose speaker. I have subscription to the Power Music app. It costs me about $100 a year, and everything is the copyright is specifically for fitness classes. So I can play it in public because I really want to follow copyright laws because I'm a librarian.
Yep, that's something we're all very much aware of, I think. Yeah, and it's good to know that there is a place to get that. Yeah.
Yes, and there's also Yes Music, yes with an exclamation point. And they're both great. I just happen to prefer Power Music. Make sure you have good chairs because you might be doing some kind of fitness classes with chairs. And then I have resistance bands, like the kinds of that physical therapists use, like the pink one that the lady in the white picture
Mhm.
is holding. What I ended up doing was I bought rolls of them, long rolls, and I cut them because that was more cost effective. The storage is very minimal for that. It takes a shelf on a cabinet, and I can teach 20 people with them. And I have various different um, strengths of the rolls. And I'll tell the people, yep, you like for this one, if this particular exercise is using our shoulders and you have shoulder issues, you might want to just stick with the yellow. If you're feeling stronger today, go with the red. For legs, we're doing black today because that's the heavy one. And I want to make sure that your legs are strong because that way your your quad muscles are stronger, which will make your femur stronger. So if you fall, you won't break your femur because the mortality risk of a broken femur is very high. Another thing you might possibly be interested in would be some yoga blocks or yoga mats. You can get those very inexpensively at wholesale suppliers, um, even um, even from Amazon. And I have also used YouTube to record classes. During COVID, I recorded a bunch of classes so that people could do them from home. I've had a few of my own medical issues. I've had a few surgeries in the past few years. And so I filmed an up-to-date class, threw it on the library's YouTube channel. And then while I was recovering from the surgery, people would come into the library. We've got a giant TV in our meeting room, and we pulled up the video, and then everybody could do class with me. And the last time they said, that one got really boring. You kept saying the same thing every single time. So they enjoy it. And with the chair yoga, they really, really loved my cats because I record them at home. So that I would just recommend that you have a good phone or a good iPad and some kind of stand that you can mount it from. Okay, and then partnerships. That I feel that this is very important. Your community is probably going to be different from my community. So think outside the box, think of who the experts are around you so that you can really make use of the partnerships that are around you. I have worked personally with our emergency services to do falls prevention and safety, because the Falls Prevention Week is the week of September 22nd. And it's been during that week that I have gone with Sulo to the community center and here at the library, no, the senior center and here at the library. And we've done talks about the risks of falling. He has talked about when ambulance department answers calls about people falling, like the things that they have seen that have caused people to fall, just in general, because HIPAA. And then when I get a chance and I have access to mats that I can pull around, then I teach people how to fall safely, because there's a skill to it. And right now I am working on getting a grant to buy some good quality mats so that and find a place that I could store them, so that for the month of September, I would be able to do a once weekly class where people would be able to practice falling. Oh, this is something I discovered a couple weeks ago. In Georgia, in Atlanta, I noticed there are a bunch of people in Georgia here. There's something called the Fall Safety, is the Falling Safely class. I found it on Facebook. They are doing some fabulous work, and they are working on a curriculum to certify people. So that is super cool. So if that's something that you might be interested in, falling is fun when you know how to do it safely. Another good partnership is if you have a doctor who is willing and able to come to your library and just sit and talk to people about different health topics, just to educate them. That would be fabulous. We have a Mayo clinic here in town, but Mayo is actually really, really difficult to work with. I'm trying to work on a recently retired doctor to come in and do talks, but I think he retired a little too recently and he doesn't miss it enough. So hopefully I can get him to come in and just talk to people. I did hire a registered dietitian to come in and do a 3-part series of workshops talking about nutrition and how it affects your body. And she was fabulous. She's a professor and actually department head at St. John's University. And Emily Hyang. She's the nutrition prof. So if you wanted to look her up, she is willing to work with other libraries. Her website is thenutritionprof.com. She came in, she asked people, what do you want to learn more about? She would prepare a lesson plan for the next class, come in, answer everybody's questions. it also became very, very clear that nutrition is very nuanced, and that it's really hard to answer a generalized question and make sure that somebody is getting adequate nutrition for and their own needs are being met. So yeah, find a registered nutrition that's near you, or if you wanted to talk to Emily, that's her website. Um, I'll have to add a couple slides. Um, and physical therapists, if you can get a physical therapist to come in and talk about movement patterns and why it's important to just even maybe go talk to a physical therapist if you're having issues with pain in certain areas. Those exercises are very, very helpful in recovery. And if somebody's injured and they only go to physical therapy once or twice, really they don't have a reason to complain if they still hurt, because physical therapy helps. For mental health, find mental health specialists. You can work with your local NAMI group, National Association for Mental Illness, for mental health
Yeah.
programming. We had NAMI Minnesota here a couple weeks ago, and we have them coming fairly regularly. There's also Lutheran Social Services that have been coming and doing some work for us to talk about mental health and different kinds of challenges with different mental, not necessarily illnesses, but different kinds of mental health challenges. And then I would say talk to your local public health department to see if they have anybody who would be willing and able to come and talk about a certain kind of health topic. Um, Possible topics would be discussions about vaccinations or dental care. So I do know that they really care about those things, and they really want to inform people. And right now we're kind of facing here in the States, we're facing a crisis of people deciding not to vaccinate, and that is a huge public health concern.
Yeah. Major problem.
Yes. And then here is my last slide. Um, oh, I completely forgot about that one, but I gave that information anyway. So yeah. Right. So that's everything I have for you. And now I'm
Mhm.
open for questions. I have my contact information if you want to ask me any other
Mhm.
things or contact me for anything. But yes, I'm
Yeah, definitely. Yes, if anyone does have any questions, we still have about 10, 15 minutes left in the hour that we can have questions or discussion. If you all have any questions, type into the question section. It's the speech bubble with a question mark on it at the top of your GoToWebinar interface. If you click on that, it will open up where you can enter your question. I'm monitoring that here on my computer. Or if you want to share, if you've done any of these kind of programs at your library, we'd love to hear about that too. What have you done? So do go ahead and get your questions in there. We do have a question about funding for buying the equipment and the bands and the weights and whatnot. Um, how is that handled?
I take that out of my programs budget,
Mhm.
and it really, like the bands, eh, they only cost maybe a couple $100 for
Mhm.
all of them.
For the
For
whole roll, like 'cause you got a roll, you said that you then like cut for.
Yeah, I got 5 rolls, and all 5 of the boxes, I think, was a couple $100.
Oh.
And yeah, it's not bad. And yoga mats and yoga blocks, again, I was able to get, I think, about 10 of each for total of a couple $100. So that's something that I would even spread out. And I always code my continuing education and my recertification under travel and training. But then again, like if you have a friends group, you can ask your friends group.
Oh, sure. Oh, yeah. There's lots of options for these kind of things. friends group asking for donations. Libraries are always getting creative with that. They were just curious, like, well, how much were these things costing? They can kind of figure out and see. So the certifications, those are things that your library is covering the cost of your certifications that you're then using in these programs. You're not having to do that personally.
Right. Yeah, because I'm not using the information to go to moonlight. Um,
Right.
I'm
Yeah.
using it specifically for the library. So just like when I attended PLA, the library paid for that.
Hmm.
So it's
Yeah.
I look at it the same way.
Right. Professional development, lifelong learning for us is just as important as it is for other people. And you need the training to do the work, to do your job. If this is a program, definitely. I know some libraries and boards administration may be a little like, why are you getting this personal certification? Why should we care? And that's the reason. It's because it's for this. I'm doing it for my job, not doing it for me personally. If I
Right.
was, and it is something you can do. I mean, you're talking about doing this with having you do as the library staff doing it. I know some libraries do bring in outside presenters, outside yoga teachers or chair exercise people, and that would be totally different. That would be like funding to pay a presenter, pay a speaker to come in for a special event.
Right. Yeah. And I did the math.
Mm-hmm.
It's if I have somebody come in once a month or once a week, sorry, to teach a class, they're usually going to be charging like $50 to $100 per visit.
Mm.
And that would be if it's $100 per visit for 52 weeks in a year, that's $5,200. That's beyond my program's budget.
Mm-hmm.
And for me to get the certification, and it costs the library um, $300 for the 2-year certification, and then maybe $200 a year for recertifications
Mm-hmm.
and continuing education. It's a big
That's
savings.
not bad. Yeah, that's a huge difference. Definitely, if you have the staff that can take it on and do it themselves, that is definitely the way to go.
Yeah.
um, all right. Other questions? Type into that question section there. I want to make sure I get everyone's questions answered. Do I have anything over here? No. Okay. Cool. Cool. Oh, someone just says saying we've been successful with that doing yoga classes in the library. They seem to be very popular, and they might start expanding into other types of exercise. Yeah, yoga does seem to be a trending lately.
Yeah.
I think the low impact of it, especially with a lot of us getting older and not being able to do, like you said, having bad knees or something. I know that's I have a bad knee, and I'm desperately trying to do things that are not running, not jumping as much. Uh,
Yeah.
and I think that's become very popular. Yeah.
Yeah. And I teach, I call it chair yoga, and then it's kind of evolved into chair assisted yoga because I have a few people who come regularly and they just do the regular yoga flows without any kind of assistance. But then I have other people who need help with the balance. So
Yeah.
they can do like mountain pose, standing or sitting. They can do, I make modifications to everything, which
Mhm.
any good teacher should be doing.
Yeah.
Um, and so that most people should be able to do the classes.
Mhm. Someone does ask, and I'm not sure if you had mentioned earlier or not. I don't recall. How many classes are you doing, like in a week or a month?
I'm
How
doing
is this?
4 a week. But like this week we have book sale in the meeting room all week long. So I no classes this week, no classes next week, and then I completely forgot there's a week after between another week between um yeah, before Labor Day. So we aren't going to have any classes for 3 weeks, and
Mhm.
that's my recuperation time too.
Right.
And they're like, we'll take a week off every now and then,
Mhm.
and everybody's totally fine with that.
But usually you said it's like four a week.
Yeah.
Yeah. So not too long. All right.
Yeah, it's 30 minutes. I get a chance to move, so I'm not sitting
Oh
at a
yeah, of
desk.
course. It's good for you as well as the teacher, as the instructor.
Yeah. Yeah, exactly. Oh, and you don't have to do it that often. You can just do a class once a week. Like,
Like you said earlier, it's going to depend on your community too,
mhm,
how much they are involved in what kind of response you get. That's what I was trying to say. Yeah, to it, and yours might be less, you might be more. Yeah.
yeah, my people kept asking for more. And I
Mhm.
mean, they ask me for Wednesdays, and I say, I can't do Wednesdays. I'm on desk on Wednesdays.
It's just not going to be a thing yet, and it's okay. Um, Oh, interesting. This another comment here. Our library had a local clinic visit to teach us stretching exercises and free spinal
Oh,
exams.
nice.
Yeah, this was very successful, and I think yoga would attract patrons in our small community. Yeah, this is one of our smaller libraries here. Yeah, absolutely. Um,
Yeah,
yeah, try something like that if you and that's actually an interesting idea there that this librarian says before you're sure your community is really into this, and you put in all the work of you getting certified and you creating this program, bring in someone else for like a one time,
exactly.
do a one shot, and see, is it popular? Do people respond? Do we get a lot? And then maybe this is something we need to develop ourselves.
Yeah. Oh, and I forgot that I had even done a survey before I even started to find out if people were interested.
Oh,
So,
sure. Yeah.
yeah. Yeah, don't spend the money before you know that that there's a want and a need for it.
Mm-hmm.
But I also provided resources so that you can do other things without having getting the certifications.
Oh yeah, there's lots you can do without, just to get started with it. Yeah, that you don't have to go all the way through getting those certifications and things. But as it gets bigger, you're definitely going to want that because you're going to have a lot more questions and things that you're going to need to be able to answer up to a point, as we all know.
Mhm. Yes.
But definitely, yeah. Yeah. All right. We just are a little after 11 o'clock here, and I do want to be respectful of people's time as much as we can. Anybody have any desperate last minute questions you want to ask of Nicole, or anything you want to share about what you're doing at your library? Type in that question section there. Thank you so much, Nicole. This was great information, lots of fun things to do. And I think, like you said, very important. We are all getting older, and everyone and my parents and us need to just be moving better. And I know I was better at it pre-COVID. Yes. That
Yeah.
kind of, I don't know, broke something, and trying to get back up on that horse again. And it helps having something like this just to remind me, yes, you can do it. There is, in the library, absolutely, like you said, literacy is literacy, and there's all types of literacy, and that we can be helping with.
Yeah. I really, really do try to let remind people that the library is about literacy in all its forms. And
Mhm.
I've gotten my library board and my staff on board with that.
Nice.
So that's what we say to people. We're about literacy in all its forms.
All sorts of types. Yep. Having that buy-in and support is also very important.
Yeah.
All right, I have some thank yous coming in. Thank you, presenters. Great info. I'm going to take this back to my library.
Oh,
Cool.
good.
Exactly what we
Okay.
like to hear. All right, so thank you, Nicole. Thank you, everybody. There is her contact info. As I said, the slides will be available afterwards with the recording as well. So I'm going to pull presenter control to my screen here and do my wrap up. There we go. All right. So thank you, Nicole. Yeah, send me your slides and any other, I think you were mentioning other resources that you want to share as well. Send that to me. The recording will be available by the end of the day tomorrow, as long as GoToWebinar and YouTube cooperate with me. That's where I post our recordings. This is our main show page. If you just search NCompass Live, the name of our show, on your search engine of choice, you'll come up with this page, as well as our archive page. These are upcoming shows, but underneath there's a link to our show archives. Most recent one at the top of the page, and that is where today's will be. Everyone who attended and registered for today's show will get an email from me when I send it out to our mailing list. But you also get it directly from me, letting you know when the recording is ready. As I said, this one, we didn't have slides last week. Yeah, we did the week before. So there'll be 2 links at the end of the session, one to the recording on our Library Commission YouTube channel and a link to the presentation slides. While we're here, if you do want to see if we've done a show on any topic you might be interested in, we do have a search here, a search box, general search box, keyword search. You can search our full show archives or just the most recent 12 months if you want something very current. And that is because this is our full show archives, and I'm not going to scroll all the way down, but as you can see, this list just goes on and on. This is our full show archives going back to when NCompass Live first premiered, which was January 2009. So we're getting up there, and we have all of our show recordings here. So just do pay attention when you watch something to the original broadcast date. Like if I scroll down even farther, here we go, all the way back to 2016. Some of the shows we find to watch stand the test of time, be good resources, but some things will become old and outdated. Resources may have changed drastically. Might not exist anymore. Links may be broken. People are going to work at different places than when they presented for us. But this is something libraries do. We keep things for historical purposes, and as long as we have a place to keep all of these, which right now is the Nebraska Library Commission's YouTube channel, we'll always have them up there available for you to watch. You can see here too, if you want continuing education credit for watching any of our live or our recorded shows for Nebraska Library staff, we have special forms for you as a librarian or your library board to submit. Anyone who attended our live show, like right now, you will get an email automatically sent to you from the GoToWebinar system saying, thank you for attending. This is your proof of attending. That has a PDF certificate attached to it. So for the live show, we push that out to you. If you're from another state and you are watching for CE, you will need to talk to whoever is your CE granting organization to find out how you get credit for watching our recording shows. We also have a Facebook page for NCompass Live. If you like to use Facebook, give us a like. We post reminders on how to sign up for the show, meet our presenter, and I do post when the recordings are available as well. So you can see on here, we use the hashtag NComp Live. We also use the Library Commission's YouTube channel, or not, sorry, not YouTube, Instagram. We have a blog on our website. We have mailing lists in Nebraska. I post things out on my LinkedIn. So we try to spread the word anywhere and ever we can. Like I said, it is a free show open to anyone. So please do help us spread the word. But if you give us a like on the Facebook, you'll get notices about what we're doing here. All right, that wraps it up for today. Next week, we'll be back with Pretty Sweet Tech. Usually the last Wednesday of the month is Pretty Sweet Tech Day. That is when Amanda Sweet, our technology innovation librarian, comes on the show and talks about something tech related. We'll have other shows throughout the month that are also tech focused, but you can depend on Amanda being here, except for sometimes when she's off on conferences or doing other things. And next week, she's going to be talking about our new WordPress multi-site option here in Nebraska. We are changing. We have offered Nebraska here at the Nebraska Library Commission, we have offered free websites to public libraries for 10 or 12 years now. I can't even remember how long ago, but we are switching up how it works, how the program works, and we have a new multi-site option. So if you're interested in that, please do join us next week to learn about all that's happening with our Nebraska libraries on the web service that we offer and what your options will be as a Nebraska library. And you can see we've got our other shows starting to fill in here in the fall. So keep an eye on here as I get more dates confirmed and things coming in for September and October. All right. So thank you, everybody, for being here. Thank you, Nicole, for sharing all this great information. Hopefully we'll all get a lot more active in our libraries.
Thank you.
All right. Thanks a lot, everybody. Bye bye.